Co-production is the coming together of people that have a lived experience of mental health and people who have skills through their profession of being a mental health worker, and it's about them coming together and having equal influence on how to move forward. So in Recovery College we'll do lots of different things, because actually learning a new interest is good for your mental health and it builds up your social confidence, but also it's good for someone who wants to volunteer and dip their toe back into a vocation, if you like, to have the opportunity to share something that they're passionate about.
I, after recovering from a nervous breakdown, came to the Recovery College, and Matt treated me as what I call a normal person, and that was at a time when I was still really quite unwell, but he gave me the opportunity to work with him. He recognised the skills that I thought I'd lost, and so I've been able to work with a range of professionals, and I haven't had that label service user or mental health user. I'm Beverly, a professional with some knowledge and things to offer. I think co-production is enormously important in giving everybody a voice.
I'm your allocated nurse for today, Alison. I thought we'd have a little bit of a chat and go through the My Mental Health booklet, which is just going to ask you a few questions about why you're in hospital, what sort of difficulties you're having at the moment, and then we're going to write you some care plans.
We work in a very challenging environment with people who were very seriously unwell. A number of nurses came together after reviewing incidents and just reviewing the lack of co-production really in our care plans, and thought, what can we do to improve this, and My Mental Health is a result of that. The aim of it is to look at what service users perceive that their problems are, things such as anger, self-harm, violence and aggression, and it's looking at how best we manage that together. This tool, we developed it in mind of having it as a passport, so if somebody goes into hospital into a different ward with people that they don't know, they can take this with them, it will be on their records. From reviewing our Datex incidents forms, we've noticed that there's been a decrease in incidents of violence and aggression. There's been a huge increase in the service users who have got co-produced care plans. There's a better therapeutic relationship between service users and staff. We're finding that there's more time to spend with service users to do therapeutic activities. We've improved our relationship with carers as well. It's simple, it's a tool that anybody can use. It's not just designed for nursing staff to use, healthcare support workers can use it as well. So this has given us the opportunity to just sit down with somebody, spend some time with people and help them on their journey to recovery.
The Early Intervention in Psychosis team, we've got 6 volunteers working alongside staff. The volunteers run the group, they help with the befriending, they get to chat to service users who come along.
Volunteering is absolutely brilliant. I do the rock climbing part of it, and it's about the smile they get on their face. It gives me a boost as well. After a certain time we've worked with them, you can tell the difference that they've improved.
They have.
And they come out, they start talking,
yeah.
and they come out of the shell.
It's also health, physical and mental health as well, which makes a difference. It's good to see people want to come that normally perhaps wouldn't join. We started with quite a small group, 2 ladies that started to come. You couldn't get a word out of them at all, and now, oh my goodness, what a difference. They are so much livelier.
Co-production, it's brought equality into the team. They're on a level with some of our service users. They can share coping strategies. We're actually getting harder to reach people who will only come to certain groups.
You know that you're making an effect on other people, and thinking that I've done something and made somebody a lot happier, it makes me happy as well.